And I'm Malika Moore. I'm a clinical social worker in DC, Maryland. I'm also the owner of Aging and Amazing. And so we're a care management group, and we're very blessed and fortunate to serve 6 of the villages in the DC area. All right. So the purpose of note taking, I think Erica kind of stole our thunder in the beginning. And the purpose of medical note taking is so that you have someone who can really get all of the information that you need from your appointment. As we all age, because we're all aging, and as we have more appointments, some more than others, it can be hard to coordinate everything, especially if you have some kind of cognitive or memory decline, something wrong with your executive functioning where planning and organizing is becoming more difficult for you. Or let's just be honest, maybe you're overwhelmed and you're tired. So just think of it as having someone who is additional support, just as we would hire maybe a housekeeper if we needed help with housekeeping, or you meal prep. So think of it as this person as an additional resource to make sure you're on top of things and to give you a little bit more free time to do what you need to do and make sure that things are accurate and you're keeping your health intact. As they say, health is wealth. So you're able to follow through with everything. All right. The benefits of medical note taking is peace of mind, clarity, and continuity amongst all of your healthcare professionals. All right. So at its core, what we'll primarily be talking about is active listening. And for some of us who may have a social work, nursing, counseling, or some kind of background related in the helping professions, this may be, you probably could swap spaces with us and teach this portion, but this really is the core of what makes a good medical note taker. Not that that person has a medical background at all. It may just be someone with a good heart who wants to help older adults, which we find a lot in our villages. So it's active listening means giving your full attention. And that means eye contact, nodding, gestures that may be going on. It means allowing space, so not interrupting the person who's actually at the appointment. And sometimes it may mean not interrupting the doctor to give them an opportunity to fully say what they need to say. Repeating back in your own words, asking gentle, clarifying questions, especially for those of you who may not have a medical background. And we'll talk more about this later, and not feeling embarrassed if you didn't quite get something or you've never heard of that medication. Some of the medications may be on a printout, but it may be a concept that the doctors mentioned that you just said, like, can you repeat that for me? You said they need to go get an MRI and then blood work here, there, so you can get clarification and you're not just guessing. And you show and care understanding. That way the person that you're with knows that you're in it for them, and even the professional picks up on it and they have peace of mind knowing that you're there to support the patient. All right. So let's go through a few active listening do's and don'ts. So you want to look at the village member when they speak, so you can hear fully what they're saying. And you also want to take a look at the doctor so you can fully hear what they're saying. So we're in this DC metro area, which is a melting pot. So some people may have accent. I know we all have accents, but some maybe you can understand a little better than others. So you want to make sure you're looking, you're listening, you're not distracted. You can nod or use short phrases, or what we would call in public speaking fillers, but you're really paying attention. You just want them to know that, hey, I'm attentive, I'm listening, I understand what you're saying, because we know that nonverbal communication speaks louder than any words that we can say. You want to write down what's important in their own words, especially if you know maybe someone doesn't have a formal diagnosis of dementia, but you've noticed that they're having some trouble keeping up with things, or during the car ride, you notice that they were repeating a few things several times, you might say, okay, let me try to use some words or phrases that they'll understand. Let me not write this too complicated. I might write some notes for them to understand, and then I might write some higher level notes for someone else to kind of read through and go through as next steps. So you want to ask gentle questions if something isn't clear. When you're going to a medical appointment, it's sort of like a home visit. You're going into this sacred pet place. Someone's let you into their home, someone's let you into their medical record, and you don't know what you might find there. And so that's a very vulnerable place to be there, to be as a person. But also sometimes during appointments, people are getting devastating news. I remember as a care manager having a client who learned she was young in her 70s and learned that she had a diagnosis of dementia. And so that was pretty devastating for her. So me being able to get down what was said, what we need to do next, while most of the appointment, she was processing what was told to her and how life would look for her going ahead in her years. So confirm that you understood. So you want me to remind you about your new pill in the morning, or you want me to make sure that those referrals are followed up with, or you want your daughter to follow up on these referrals. So making sure that you understood what they said and that you're writing it down. And that same thing goes for the doctor. All right. And then for active listening don'ts, interrupting while they're talking. Sometimes it depends on your relationship with the person. You may be going with someone you don't know very well. Sometimes when your comfort level's a little bit more relaxed, maybe it's your friend and it's like, oh, well, we interrupt one another all the time when we speak. So trying to keep that at a minimum when you're at the appointments, and even letting the doctor finish their statements. Every appointment is not going to be butterflies and rainbows. There are going to be some appointments or some personality types that are going to be some more argumentative, or just like you have some people who just challenge, like, hey, I want to know the what, when, where, why, how, and they want answers right then and there. So leaving space for that, but also you may know realistically we may not get the answers that they want. So you could also be a level of support to that person and say, like, setting their expectations. Or maybe they're not hearing the doctor, but they hear you because it's a different level of trust that they have with you. Looking at your phone or getting distracted. So we are in a day and age where we have all these different devices. We have our tablets, we have Kindles with the writing tablet, we have Remarkables where you can write notes. We have all these wonderful devices that I'm so excited about and like trying. But you have to make sure that it doesn't come off that you're not paying attention. For example, when I see clients, sometimes I do take electronic notes on a device or something like that. And I'll say, hey, you'll see me looking down at my phone because I'm taking notes. Or so that person doesn't think I'm on social media scrolling, or sometimes people will think you're recording them. So just being sensitive to the day and the age that we're in now, where people are a lot more sensitive, and I don't want to use the word paranoid, but I'm going to say more hypervigilant about what's going on with technology and what people are doing with it. Because I think we could probably name a million scenarios where we've seen things that people shouldn't have posted on social media, which has created fears in people. So just telling them what you're doing. And if they don't like it, then finding another way. So having an alternative method, just in case. I know I used to do therapy, and some clients didn't like me to write notes while we were talking. Like they didn't like me to jot notes. So if I knew that that wasn't good for them, then I stopped writing the notes. So I had to come up with a different strategy to kind of get what I needed to follow up on and to make sure I added, just so I wouldn't make them uncomfortable. Jump in with your own story or opinion. This is something that I think people do very innocently. They want to tell you about their cousin and their aunt and their sister who had that diagnosis and what happened to them and what they did. It may be a time and space for that, but sometimes it can hinder. Imagine telling someone who maybe just got a diagnosis of breast cancer that, oh yeah, my aunt passed away from breast cancer a year ago. That might not be very helpful at that time, even though your intentions may be to connect and to let that person know you're there. It could probably exacerbate or create some new fears that they're probably experiencing anyway. So just being mindful of yourself if you have a tendency to want to share stories, that it might not be a good time. Ignore their feelings or concerns. We all have different personality types. And what I've noticed is that sometimes people do a really good job at masking. So, how they're presenting to you on the outside may not be how they're really feeling on the inside. You may have someone that seems very hard and aloof or just angry, but you don't know how they are when they go home at night. They close the door and nobody's there. So even though you may think, oh, this person is like that, a lot of times we've worked jobs, we've had different positions, been in different arenas, and people learn how to mask and how to adapt, but that may not be really who they are. So being mindful, like Freud said, every person that you meet is just the tip of the iceberg. So keep that in mind with your active listening. And don't assume you understood without checking back. If you thought you didn't hear the doctor correctly, even if you feel the doctor's getting annoyed or rushed, you got to think of it as like, this is my duty. This is why I'm here. So could you repeat that? You said what bone was cracked? Like, I didn't get the name of the bone. That may not be your background. Don't be embarrassed about it. Just ask more questions. All right. Relationships matter. So Kate and I are social workers. And I always tell this story when I was a social work intern many years ago now. And I remember my supervisor handing me over a stack of assessment forms. And I was like, oh my goodness, I have to go to this home and get all of these forms done. And I remember her saying, Malika, wait, stop, wait a minute. You're not getting a thing done if you don't build a relationship with that person. So it's the same when you're doing medical note taking. It doesn't matter how great you are, what credentials are behind your name, if you're a retired nurse, social worker, it doesn't matter. If you can't build a relationship, build rapport very quickly, that person may not be receptive to what you have to say. It'll fall on deaf ears. So you need to try to build some kind of relationship where the person feels comfortable and they trust you. And even being able to go back if you've been part matched with someone and you just feel like the match isn't working well, being able to say, I just don't think this is a good fit. I want to help, but I'm unsure that I'll be able to get too far. This, keeping in mind that all relationships aren't perfect. Sometimes people have a guard up. Like maybe they've let somebody in that they trusted and it didn't go so well. So some relationships will have a few like growing pains, but if you just feel like it's persistent and you're just not getting anywhere, they may need somebody else, a better fit. Everything's about goodness of fit. So if you're starting to get matched with someone, you've built that relationship, you have a good rapport, and you're starting to get matched with them frequently for their appointments, I want you to start gaining your confidence and start noticing patterns. If you notice that, oh, she was on top of it, she had her questions ready, and now I notice that she's shuffling her feet and something's just different about her, or him or whoever your client is, you want to be able to record that, because that's what a good medical note taker would do. They would notice. It doesn't start at the appointment. It starts as soon as you get in front of that person. So you're going to notice changes in their health, their mood, their memory. What's coming to mind is one of my clients who had a diagnosis of Parkinson's. Before we got that diagnosis, I had been spending so much time with him as his care manager that I noticed he was shuffling. So when we went to the appointment with the neurologist, I said, he's just shuffling, and it's all of a sudden, it's like he's just. So she said, oh my goodness, we need to possibly, I'm thinking, test for Parkinson's disease. And that's how we ended up getting the diagnosis. So you all have that power to notice trends and connect those dots that may help your person get treatment that otherwise no one would know in that short medical visit. Also, concerns repeated from visit to visit. Sometimes you are going to appointments and it's like, didn't we talk about that last time and we didn't get an answer? So being able to notice those trends or notice things that your person's bringing up from time to time, or even gently being able to say, hey, have you noticed any trouble with your memory? I noticed you asked me my name 5 times or something like that. So once you build a relationship with someone, they may not be as offended if you ask them things like that. So support quietly. So keep a running list of the appointments. And what requires relationships, say there's something that you need to share with the doctor that you feel that the person isn't sharing. For example, I had a client who fell like multiple days in a row. We finally got her an appointment. We got into the appointment with the doctor. She said, oh, everything's fine. Like everything's great. I'm okay. And it was there I opened my mouth and say, oh, she fell Monday, Tuesday, and Wednesday, and this is why we're here. So I had to be strategic. I built a relationship with the front desk people, the receptionist. Also, I was able to slide a note and say, hey, I know we're going to go in here and everything's going to be perfect and we're going to leave. I just want to let you know I'm concerned about the fall she's had the last 3 days. So that gives the doctor kind of a lead in to be able to say, so have you had any falls? And if they say no, kind of probe a little bit further so you can get some attention called to the issue. And then just remember that you're supporting, not speaking for the village member. So that's not your role to speak for them, is to be supportive. But as you get a better relationship with people, you are able to help a little bit more than when you just start with someone brand new. And being able to, you can also check in with your village to see, is this within boundaries or am I kind of going outside of my scope?
Now we're going to go over a couple of pieces of advice and things to think about before the appointment even begins. So first and foremost, note-taking methods. Use what works best for you, but also what is comfortable for the client or person you're serving. So, if your village has a note-taking form, you can request that for appointments. If you prefer to write things physically, you can use a notebook, or you could use a tablet or computer or your phone, of course, with the permission of the person that you're serving. And always make sure that you honor confidentiality with any method that you use. So, for example, if you're using a notebook, maybe you let the member that you're serving keep that notebook, and then you pass it back and forth between appointments. So to maintain confidentiality, so that you don't take the notebook home, and your spouse or your child or roommate looks at your notebook and says, "Oh, I didn't know you were doing this," and finds out something. For the person that you're serving. Before the appointment, always make sure that you have an updated medication list that you take to appointments. Collect all emergency contact information that you need so that you can prepare for the unexpected. Have a folder or a binder that you can keep for visit notes. And then always identify priorities and review past concerns before every appointment. And we'll go into a little bit more detail on these. So prepare for the unexpected. As I said, have emergency contact information ready. You never know what could happen in a situation, and know what to do if the client becomes ill during the visit. So kind of review, of course, the plan if something were to happen, maybe know what hospital they prefer to go to, what medical system they use, and then, of course, who to call if something were to happen, like a fall. And then always stay calm, supportive, and focused on what needs to be done in order to protect and maintain their safety. And then, when in doubt, always contact your village contact. So, active listening before the appointment, what this looks like, ask the village member how involved they want you to be as a medical note taker. What kind of questions do they want you to ask? Do they want you to make sure that they ask this specific question to the doctor if maybe it lapses their memory while they're there? Review their medication list with them and priorities so that you know what matters to them. Again, this goes into how involved do they want me to be while as their medical note taker at this appointment. Listen carefully to their concerns ahead of time. Ask them, what's the goal of this appointment? What are we wanting to achieve with this appointment? And how can I best support you to achieve that goal? And of course, write these down so that you yourself don't also forget what the priorities are of the member that you're serving. So again, these are kind of some key questions. What is your goal for this appointment? What questions do you have for your provider? And how can I best support you during this appointment? And what do you need to update your provider on? Has there been something that has happened, like a fall in the past couple months since you've seen this provider? Has there been a new medical diagnosis from another provider that this provider needs to know about? For example, if I had a client who has a neurologist, has a cardiologist, has a primary care physician, I want to make sure that all of those concerns are being communicated between all the parties involved so that the best care is being put forward for the member in question.
All right. During the appointment. Okay, so respect, it goes along with rapport. So we got rapport, respect, how involved would you like me to be, protecting dignity and privacy, and honoring personal choice and participation. And so what active listening looks like during the appointment is mostly what we talked about earlier, is giving your full attention, your eye contact, not nodding, and open body language, not interrupting, reflecting back what you hear. So I hear you're saying the new pill should be taken in the morning, or you also could reflect body language. You may notice their face changes when the doctor says something, or they look sad or unhappy, reflecting that. Clarify instructions or questions when needed. Note the doctor's directions and the village member's concern. And also, you can create a secret code with your member that may look like, hey, we'll message one another during the appointment. I have my phone, you have my appointment. Or if I say this, if I put a finger up, I'm ready to go. You can have your own little code that you make up. And that's a part of active listening. You can be creative with it also. Okay. The practicals of note taking. So noting vitals, write down any symptoms listed by the patient, and you, depending on your relationship with the person, may be able to add to this list. Like, hey, we talked about your memory concerns, but I noticed it's not on this list. So let's add it to the list. Note the questions asked by the doctor and note the questions asked by the patient, and don't be afraid to ask questions, which we've already discussed. Okay, capture key information, doctor's notes, and the questions beyond after visit summary. So that after visit summary is going to be concise. It's not going to have the nuances of, hey, the doctor said this and asked why we didn't go do this and recommended we should try this. The doctor's notes won't have all of that, but your notes will. And then you want to create any action, follow up on any action steps, or group the action steps that need to be done. Maybe you need to follow up on a referral and progress notes reflecting the client's voice. Also, in capturing key information, you want to be sure you kind of get, well, who does the person want this shared with? Even though it's their relative, it may not be that they want it shared. Even though it's the village, they may not want it shared with the village. So really making sure you're getting key information that's pertinent for your member. Ethical and practical considerations, maintaining confidentiality, protecting sensitive information, and supporting autonomy and dignity. So maintaining confidentiality, which Kate already touched on, includes where you're placing these items. Are you putting them in a place where they could be compromised later in your email or in your notebook, or where are you placing this information? Also, it could look like you go update the daughter or the son and they told you they didn't want to. So they didn't want you to update that person. So as being very clear on who they want to be updated. And also, since we are a village and we are neighbors, everyone may know that neighbor. So just being mindful that if you're out on an event, it could, maybe someone saw you walking out of GW. You don't even have to disclose why you were there. Like, let people assume why you were needed, and let the person introduce you. Like, let them say, hey, Cindy's helping me with this appointment today. Support autonomy and decision making to the client. So people, unless they just don't have any capacity and you're really concerned about that, go to the village. But people have the right to make bad decisions. And I know that that's something that's kind of big. We want people to do the right thing. We want people to follow up on certain treatments or do what's right, but what's right for them may not be it may not align with our personal values. So being able to respect that, but also highlight any concerns to the appropriate person.
So after the appointment, we want to always practice active listening. Some ways that this could look like after your appointment: repeat back key points to confirm accuracy with the village member. So, some of those action steps that the doctor mentioned, or some of the concerns that they mentioned to the doctor, or that the doctor mentioned themselves. Repeat those back to confirm with the village member that we're kind of all on the same page, if you will. Ask them, did I capture what felt most important to you today? Did I support you in the way that we kind of outlined before the appointment? Which can also ensure that you yourself are always improving and always doing right by the member, and putting your training, if you will, into practice. Um, Always listen for emotional reactions or unspoken worries. So if a new medication was prescribed at the appointment and they say, I'm nervous about starting this medication, listen, ask, support, be an emotional support for them, just as you're being kind of a physical and mental support through the note taking. And then always make sure that you organize the notes clearly for the follow up with the village contact or with the family. So the people that are authorized by the member for you to speak to, make sure that those notes are organized and concise, so that, again, everybody can be on the same page and follow up steps can be taken appropriately. And then always encourage the village member's voice in the next steps. Be that supportive person while also supporting their dignity and respecting their autonomy. And then always use silence. Silence can be an incredible tool to encourage the member's voice, but also to be a supportive person in their life at that moment. You might have had a client or a member who has been diagnosed with something like dementia or breast cancer. And as Malika was saying, in active listening, you don't always want to try to relate it to something that you've been through. So you can use silence as a tool to encourage their thoughts, to feel like they're fully able to process those. And then you never know what might come up in those moments of silence where they feel the opportunity to share something that is heavy on their heart, or to feel like they can share what they're going through in that moment. And then just some practicals of after the appointment. Note time sensitive action steps. As we said, organize these notes in a visit folder, confirm the next steps with the client by using that repetitive sort of active listening tool that we talked about. And then, of course, share the notes with the village contact or family that is authorized by the patient. And then writing a care summary, the practicals of writing a care summary. So this is kind of an appointment summary that can help the client maintain consistency and continuity of care. This can go along with visit notes from the doctor, and appointment summaries can really help kind of provide a accurate history as well for members and for clients. So always write the summary in the third person. Utilize bullet points and avoid large chunks of text. Highlight specific points and include action steps that were given by the provider. And then always include upcoming appointments so they have some sort of calendar, if you will, to maintain these appointments. And this is kind of an example of what a care summary would look like. You would have the village member at the top, the date, the doctor or the specialty of this doctor, the top concerns or questions noted before the appointment, the doctor's instructions and follow ups given during the appointment, and the village member's concerns that were voiced during the appointment. And then after the appointment, the key action steps that were given, the notes that you need to share, and then always the next appointment. And if you are interested, we do have a free template that we can give that our company has created. So if you are interested in that template, please just let us know. We will have our contact information at the end of this presentation. Please feel free to shoot us an email or give us a call, and we can connect on how to get this care summary to you. So now we're going to do an instance of real life application. I'm going to share a story with you of a client that I have. She's an 82-year-old woman. Let's call her Sarah. And Sarah is dealing with some forgetfulness, but she doesn't have an official diagnosis of dementia. She's going to visit her primary care physician for her regular follow up, but she's been falling a lot and she is kind of hesitant to share this falling. She's very private and she's fiercely independent, which we want to protect that independence. But again, we're dealing with frequent falls and we want our primary care physician to know about this. So we're going to open it up for a little bit of discussion. How do you think you would address the situation before, during, and after the appointment?
Does anyone want to raise their hand and unmute?
I'm sorry, I joined late for various reasons. And I would say with a patient like this, I think you would discuss with the patient beforehand how she feels about falling. Many of us, and I count myself, are not keen that people know how much we fall. And I think you need to get over that hump. And in my experience, and I have done this before, I hope that the patient, when you see the doctor, will raise this on her own. But if she does not, I would be inclined to prompt her. So that you're saying, this would be a good time for you to talk about your balance. And I don't know that you need to use the word fall, but it's all about balance and, eyesight and everybody I know seems to have numb feet. So there are all those problems which go into it. And we'll assume that the doctor will then recommend physical therapy. Just assume that, or should assume that, or he should assume that. Am I heading in the right direction?
Thank you. Okay, I got a few comments.
Yeah, I will just say very quickly, is it Jeannie? Is that how you say your name?
Jeannie, yeah. Mm-hmm.
Well, I think that Jeannie brings up some great points. Before the appointment, obviously ask, is it okay if I prompt any sort of discussion? If this is something that you feel uncomfortable talking about, how can I support you the best to talk about this with your provider? And then Malika mentioned earlier in the presentation too, if they are uncomfortable talking about something, but you really feel like this is something that needs to be addressed with the provider, you can always kind of slip a note to the receptionist or to the doctor and say, hey, this is a concern that she has. She's very private about it. These doctors, for the most part, they have been dealing with patients who are uncomfortable talking about and of the variety of issues that can arise as we age. And so they will know 9 times out of 10 that you always have an anomaly, but they will know how to bring up these conversations as well if there is some sort of discomfort on part of the member. Malika,
Mm-hmm.
do you have anything to add?
Yeah, I think that was wonderful. I also, what's your background, Jeannie? I'm interested. Are you?
You know what? I think in my next life, I will be in medicine. I really like it.
Oh,
Um, but
oh,
anyway, no, as I say, I have had some experience doing this, not under Northwest Neighbors Village, but privately for friends. And
okay.
and so I guess I I also think that sometimes patients do not have the vocabulary,
Mhm.
Mm,
and I think it's all right myself, depending on your relationship with the patient. You know, if it's somebody you really don't know,
Yeah.
tricky, to speak directly to the doctor and saying, I know that she is worried about this, but doesn't know how to tell you.
Right.
mm.
So you hit the nail on the head with relationship. I know you joined a little late, but
I'm
relationship,
sorry.
you were, oh, no, you're fine.
No, no, no. I'm really sorry about that. There's,
No, but relationship is key. And also I talked about earlier about having your own language. Like you may have your own words that have certain meanings that may make your person feel more comfortable. The doctor may be totally clueless, but you can key him in or fill him in later that, hey, that means she had a fall, or hey, that means that she had a couple of drinks, or hey, all of those things that people may not want to openly discuss, but since we're human and we're living, that we know they're a part of life.
Any other thoughts?
You can raise your hand.
I'd like to bring up a point. Can you hear me?
Yes.
Oh, okay. One thing that I don't think was mentioned was the use of medical terminology by healthcare professionals, physicians particularly. And I have a recent example. I was in a physician appointment with a friend, and he was going over the person's CT scan, and he said something about atelectasis. Well, the person didn't know what that meant. So we spoke up, and then the physician apologized and he explained what that meant. And I think it's very common for professionals to use medical terminology, and uh, people don't understand what that is. And I think they need to be called on it and asked to clarify.
Yes, of course. You bring up a great point, and that was directly relates to when we were talking about don't be afraid to ask questions. You're exactly right that sometimes you can feel rushed in a medical appointment. You can feel like, the doctor has all these patients that he has to get to, and you're just one of them. But as medical note takers, we have the opportunity to be able to advocate for our members and for our friends and for our clients, and say, oh, can you please explain what that term means? Or, I really don't feel like this concern has been addressed. Can we talk more about this? And gently, of course, request and confirm and kind of reaffirm with the doctor or the provider that you're seeing that, could you take a little time here to make sure that our concerns are being addressed, or to explain that terminology? So that's a great point. Thank you so much for bringing that up.
Absolutely. And I want to add that even as the medical note taker, it may be where the member understands it perfectly, but you don't. So it's okay to say, hey, can I get clarification? That way your notes are accurate. Because if you're just totally clueless on what the doctors are talking about, then how can your notes be accurate? So that's like putting your pride aside. You probably went to school for art or whatever it is. Like, just ask the question, and you can say, I just want to make sure I'm accurately conveying your notes and I understand what the doctor's saying.
Malika, do you want to move on to questions?
Sure.
So this is Q&A. I'm unable to see the chat on my end. So if there are any questions in the chat, we can go through those, or people feel free to raise your hands and
I can see
ask any questions you have.
I can see the chat, or you can raise your hand and ask us questions. Maybe you have a scenario. If we do, we just ask that you change the name, and like no disparaging marks about doctors. I know we all have different experiences. Cynthia. All right, hold on one second. Let's unmute you. Okay, go ahead, Cynthia. It's your
Hi,
question.
yes, my question has to do with, in practice, the continuity of this, because some of your points seem to assume that the note taker has an ongoing relationship with the member that they're going to doctor's appointments with. But my personal experience, being a driver and computer assistant and whatever, is that I see, I go to things with somebody one day and somebody else another day, and they have other people going with them. So I don't know, one, whether in a village situation for this role, they make a point of always, of trying to get a volunteer who will go to all appointments with the same person, or if how information is shared among the people. Say I go one week to a doctor's appointment and somebody else goes the next week, and how that is normally handled.
Kate, did you have anything before?
I do actually, yeah. So that is one of the reasons. Thank you. That is an amazing point. That is one of the reasons why I oftentimes think that in a village situation, now, of course, your village may have different protocols that they want to kind of abide by. But generally speaking, I think that that's why a notebook is probably the best. That has kind of consistent care summaries, so that the member themselves can keep that notebook, not only for themselves, but also for the various volunteers that they have, helping them out with medical note taking, so that the next medical note taker that comes along can look at the previous notes, can look at that care summary, feel like they're up to speed, and then also use that information to build upon the rapport and with the client, with the member, and also can voice any concerns that the previous medical note taker had, or questions that the previous medical note taker noted, to provide that continuity of care. Of course, this can also be done electronically through email. Might be a little bit more difficult. Again, it depends on the specific protocols of the village. But that's why that notebook, I think, that we mentioned, having the member keep, can kind of alleviate some of that concern and help with the consistency and continuity of care.
Okay. Yeah, I like that, Kate. I do want to add, Kate mentioned earlier, a folder. So something that we do with our clients is we're infamous for is our red emergency folder. So we have this folder that we have in our client's house, and it's placed in a certain place. They may remember it's there, they may not, but we know where it is, and hopefully they don't touch it. But I would check in with your village to see if they don't mind the information being shared with the village, perhaps you can give them a copy of the template form or something, so someone will have information. And we're dealing with human beings, like even things like getting a medication list. You may not have it. You may have a bag full of medications that you want to just pick up and carry to the appointment with you. So check with your village and ask how you can create continuity, but some ways is a notebook, a folder, a form, if they don't mind it being shared with the village, so the next person can kind of pick up where it was left off. And I know I'm checking the time. We got 10 minutes, and I saw something in the chat that portal access is very important.
Very
That
much.
is that is great. I mean, we love it as care managers, but also keep in mind your role, because you want to make sure that that's okay with your village and you're not going beyond any boundaries trying to be helpful, because now you're talking about passwords and it can get a little messy if someone doesn't know, like, or, give permission, and you're in a volunteer role, and as someone mentioned, you could be seeing different people every week and you may not see that person again. So ask your village protocol, not only to protect that member, but to protect yourself as someone who's helping them. But we love portal access when we're able to get it as care managers and work with our clients. I was unable to take sufficient notes today as the info disappeared too quickly, in my opinion. Okay. Oops. So, is there any way for me to get access to your written presence? Oh, absolutely. Sure.
Yes. We'll.
Okay. Have you talked about HIPAA rules? That's a whole presentation in itself. So we wanted to make sure we overviewed highlights. Is there something specific you have a question about? You can type it in the chat. And while you're typing that in the chat, we will hear from, I don't know who was first. I'm just going, who's on my screen? Cindy.
Hey, everybody. So I'm the volunteer coordinator at Arlington Neighborhood Village, and we do have several of our volunteers on the call today. Just so you all know, from ANV, we don't have a formal medical note-taking program yet. It's something that we've talked about. So a lot of this information is great, but our folks have been involved with that role more informally. So I'm wondering, Malika and Kate, if you have resources, or if you can point us towards other villages that have kind of robust programs where we could learn from some of our colleagues to get the right policies. And, you're talking about resources that could be handed off between volunteers. I mean, this is all things that we might aspire to, but we don't have that in place yet. So any advice on a village kind of looking to how to implement this kind of a program in a more formal way?
Absolutely. So I would say start with the Palisades Village. I'm just putting them out there because I know they've reached out to us and said that this is something that they're going to be implementing. And Anne's on here, so if I misspeak, please unmute. That they're going to be implementing in a more formal way to support their members. And Anne could probably speak better on that. But of course, we work with the villages. So we would sit down if they needed us to help them come up with anything or create any forms. We would help them alongside. So I would start with maybe Ann and Erica to see like where they're going with it. And
Okay.
of course, reach out if you need any support in kind of putting together a protocol.
Yeah, we're always happy to support as well, from our perspective as care managers. This is a huge part of our job, and we'll have our email at the end of this presentation if you want to connect via email or get our information from Anne and Erica as well.
Great. Thank you so much.
Yeah, of
You're
course.
welcome. Jamie.
Hi, I have what I hope is a quick question and answer. I want to thank you and Kate too. This has been really, really helpful. Do you have experience with asking to record an appointment in addition to taking notes?
Repeat the question for me.
Whether you have experience in recording a medical visit in addition to taking notes.
Okay, go to the next. I think it's on our next slide.
It's not the next one, but it's this one.
Okay. All right. So that's tricky because you have to ask for permission. I know a lot of times people are using the audio on their phone to record notes and get them transcribed. So we've had people do it, but it all depends on relationship.
Right.
Because your doctor may say absolutely, and your doctor may say absolutely not. Like you cannot record. We just need you to scribe. But sometimes if you can explain your why behind it, like we talked about social media and everything earlier, people are afraid now because so many people post things to kind of post a review rather than to maybe help someone. So I think if you're able to explain your why, maybe you have someone who they would benefit from it being played back. But for others, it may be too much information. They may not ever play that recording back. So I've had clients do it, but I've seen it with clients who have been with the doctor forever and the doctor trusted that their intentions were good with getting the information or knew they had some kind of medical impairment where they needed it recorded.
Right. So it's a case by case basis.
Case by case situation. But we have this resource page. So of course, maybe controversial, but artificial intelligence is something that people are using to help if they need a trigger with coming up with questions, especially if someone's not too familiar. Something that we buy all of our care managers is a Zago Care System. It's a colleague of mine that I'm on a board with, and she had a son who was very ill, and she went to a lot of doctor's appointments. So she actually compiled all of her questions over the years while her son was alive at different stages. And so we have that as a resource, and then recording with permission. And Kate, can we go to the next slide? Yeah. All right. So we can break this down and be here all day for a presentation, but we wanted to give you the nuts and bolts to kind of getting this done and what you should be thinking about. But the goal is that you have dignity, clarity, and support for the member. Next slide. And here's our information. And if you want the slides, just send us an email and we'll get the slides out to you. We also can give the slides to Anne so they can send out whatever's easiest. But here's our information. And it is exactly 11:59. So unless there's a final question that we can get through quickly, we've enjoyed this so much. And thank you for having us. Thank you for the chat. We're looking at the chat. Thank you for all the kind comments.
Thanks to everyone for joining today. Have a wonderful day.
Thank you,
Thank you.
Ian. Thanks for the
Thank you.
invitation.
Bye, everyone.
Bye.